Hello and welcome to abxtracker.com, your most efficient and cost-saving solution for antimicrobial stewardship. This video is about the Influenza tab on the welcome screen menu. Under this tab, we have three different options. Let's find the Influenza tab. We have potential influenza illness. This button you would utilize if you suspect influenza on a patient. Basically, in influenza season, if the patient is displaying signs and symptoms of influenza, you would use this SBAR form. We have confirmed influenza here. This would be if a patient was confirmed of having influenza. Example would be if the patient went to a provider appointment and came back with a diagnosis of influenza, or if the patient was seen on rounds at the facility and was diagnosed with influenza at that time, and an SBAR form was not utilized prior to that. The third button is Influenza Outbreak. This tab will be fully developed in Phase 2 of abxtracker.com. It will be most useful when an outbreak of influenza occurs in the facility and there is a need to treat everyone in the facility either prophylactically or for a treatment dose. It will consist of a patient-specific parameters that are needed when considering an influenza treatment and will generate all appropriate faxes and documentation required to send to a provider to get the orders to treat. Again, this will be a Phase 2 item. Let's walk through a potential influenza case. Say your staff sees signs and symptoms of influenza in the building. They would log on to ABX Tracker and click the Influenza tab. They would then click on Potential Influenza Illness. This will bring up a form that needs to be filled out, very similar to other SBAR forms that you have previously seen. Consists of the patient's first name, last name, medical record number. Again, this is an essential part to get correct as it syncs other antimicrobial use to this medical record number. If your facility medical record number contains letters or special characters, do not enter those. Only enter the numbers in your medical record number. Next is date of birth. Your name, the provider you are sending this information to, your room number of the patient. Please note that this is also important to get correct as this syncs the room number to the facility map report. If your facility has more than one bed in a room, please indicate that here. As usual, the system has the ability to calculate creatinine clearance for you, as the medication used to treat influenza need to be dosed appropriately based upon the kidney function of the patient. Indicate if the patient is on dialysis or not. Then you'll be asked if you have the appropriate information to calculate creatinine clearance. These include recent serum creatinine, weight, and height for this patient. Indicate the gender, enter the weight in pounds. You do not need the label. Height in inches, again, no label required. And then the most recent serum creatinine, no label required. Now we enter the patient's vitals. Blood pressure, no label required. Heart rate, no label required. Respiration rate, no label required. And temperature in Fahrenheit, again, no label is required. Now we need to answer some pertinent questions that will help the provider decide if treatment is required or not. Does this patient have diabetes? Does this patient have COPD? A current smoker? A former smoker? Is this patient on warfarin therapy at this time? Does the patient have any medication allergies? It will make you list them here. Does the patient report chest pain or difficulty breathing? Yes or no? Does the patient have any other active diagnosis, especially lung related? If so, you'd list them here. If not, or you don't know, list that as well. Next, we need to click the appropriate patient signs and symptoms of influenza. And did these symptoms develop abruptly? Also, you would type any other information you want the provider to know here. Lastly, we click Submit for Tracking and generate SBAR form. Now, as before, this does two things. A window pops up. Again, reminder that your pop-up blocker is off on your web browser. This contains an electronic health record note that can easily be copied and pasted right into your system. After you're done, you can close out of that window. The second form that you see is the SBAR document that you typed information into. It includes all the pertinent questions that we went over in the form, all the appropriate signs and symptoms that the patient has, as well as your other information. It also gives the physician examples of things to do besides order an antiviral agent, and the ability to order an antiviral if needed. It also has the creatinine clearance right here, so your provider can appropriately dose the medication. And unique to the influenza, the third page consists of guidelines for influenza treatment and guides the provider on what to do for a prophylactic or treatment dose. Also cross-references the creatinine clearance. So, again, at the top of the form, we have a print and a close button. This can be printed and faxed, or it can be saved as a PDF via the print button here. Once you have done either of those options, you can click the close button. And you'll be back to the welcome page. On the welcome page, you'll see the document on the bottom under the pending list. You can use the variety of sort functions here. You can search with the unique patient identifier here, or, like I like to use, just the date entered. And you can see we have the flu. There's the unique patient identifier here, our room number. You can always view the SBAR form again by clicking this spyglass, or view the electronic health record note by clicking this spyglass. So once the provider responds, like other SBAR forms, we need to put that into the system. So let's click Finish SBAR. Please enter your name here and click the appropriate response that the provider did. Also, was an antiviral medication prescribed? If yes, click yes. If no, click no. We will click yes for now. The data was prescribed. The medication was prescribed. The dose of the medication, you check here. The route of administration. Frequency. And the duration of therapy in days. You can either add the label or you don't need to either. The type of infection, where it was acquired, community acquired, hospital acquired infection, or nursing home acquired infection, or unknown, or other nosocomial infection. The type of influenza, if a test was completed, and the prescriber prescribing the medication. Now we can click Submit Provider Responses and close the SBAR form. After this, it will be brought back to the welcome page. So now it's also important to track if the antiviral medication worked or not. We complete this by going to the Outcomes tab here and then enter Patient Outcomes. You'll see on the completed order section that the SBAR should be here. Here's our unique patient identifier, which you can always search for, the infection type, or the date entered. Again, a variety of sort options are on the top. You can view the SBAR form. And now that the patient has completed the therapy, we will click Outcome. Now we click on the appropriate outcome of the medication, as well as type any other information here. And submit treatment outcome for tracking. You will then be brought back to the patient treatment outcomes page. To get back to the welcome page, we click on the welcome tab and the welcome button. Again, the same 3 steps are used for each SBAR form under this Influenza tab. If you fill out an SBAR form for potential infection, that's the first step. Once the provider has responded to the SBAR form, you log in, you find it under the pending orders, and click Finish SBAR to put the provider responses in, or if an antiviral medication was prescribed. 3, we complete the Outcomes section in the Outcomes tab and the Outcomes button here to tell the system if the antiviral was successful or not. That's it. If you feel like you've made an error on the SBAR form, please alert your administrator or the person with the administrator login. Now, let's move on to the other buttons in the Influenza tab. The next button is Confirmed Influenza. This is where you document patients that have confirmed influenza. Click this button if you have a patient that has confirmed influenza and an influenza SBAR was not completed. Examples of this would be when the patient goes out to a clinic appointment and comes back with a diagnosis of influenza and an antiviral agent, when the provider rounds at the facility and diagnoses the patient with an influenza infection and an antiviral is ordered. Let's just view the information within this button. It consists of the patient's first name, last name, medical record number. Again, it's essential that you get this medical record number correct. Date of birth, employee entering this information, so your first name, room number, again, essential to get correct as this syncs to the facility map report. Bed, as before. Type of influenza, if it was tested. Antiviral agent prescribed or not. If yes, it'll make you fill out what was ordered. The dose. The frequency. Duration of therapy in days. What's interesting about this is it also indicates if the patient was vaccinated for influenza this year. Type of infection, where it was acquired, and the prescriber's name. After you fill out this form, you hit Submit for tracking, and it will be brought back to the welcome page. Now let's quickly review the last button in the Influenza tab. Note, this button will be released at a later point in time. It is the Influenza Outbreak button. Using this button, it will allow you to generate faxes for all patients within the facility in the event of an influenza outbreak, as defined by the CDC. As you know, if there is 2 confirmed cases within a skilled nursing facility, it is recommended to treat the entire facility prophylactically with an antiviral agent. This button will provide a one-stop page to enter the patient's name, date of birth, medical record number, gender, weight, height, serum creatinine, and if the treatment is actually for a confirmed case of influenza or a prophylactic dose. Once all the information is entered, you will click Generate and it will create all faxes for you to print and fax to the provider. This will alleviate the panic mode that most skilled nursing facilities go into when trying to figure out everyone's creatinine clearance and dose. Again, this will be released at a later point in time to the website. An indication will go out via email to let everyone know when it is ready. This concludes the portion on the Influenza tab. Thank you for watching.